Narrative therapy. Brief history. Narrative therapy, form of psychotherapy pioneered in 1980s by Michael White and David Epstein. Michael White regards problems as things that happen to people rather than as things people are doing wrong. David Epstein fostered development of self-help league groups of people battling same problems. Does not view problems as inherent in individuals or in families. What is narrative therapy? Narrative therapy is a strengths-based on therapy, focuses on self-defeating cognitions, stories people tell themselves about their problems, core beliefs about memory, part historic and part social construction, powerful social figures, create standards on which people judge their bodies and achievements and personalities. How does narrative therapy work? Encourages people to rely on own skill sets to minimize problems in everyday lives. Expands clients' thinking by encouraging them to consider alternative ways of looking at themselves and their problems. Externalizes problems and challenges pessimistic versions of events to make room for hope. Goals of narrative therapy. Externalize problem, separate people from problems, unite family to fight common enemy, search for unique outcomes, times when they resisted problems, liberate persons from problem-saturated stories, disabling stories people tell themselves and what society has told them about who they are. Narrative therapy strategies. Deconstruct unproductive stories, question assumptions, reconstruct new stories, creating new and more optimistic accounts of experiences. Externalize problems. Problems are personified, portrayed as unwelcome invaders that try to dominate people's lives. Who's in charge, the person or the problem? Determine how the problem has disrupted the family versus how they have been able to control it. Narrative therapy strategies continued. Reading between the lines of the problem, story unique outcomes when clients were able to avoid problems effects, reauthoring, exploring past and present victories over problem, reinforcing new story, find audiences to support new stories, deconstructing destructive, cultural assumptions, determining how client has been influenced by socio-cultural beliefs. Stages of narrative therapy. Recasting the problem as an affliction and focusing on its effects rather than its causes. Finding exceptions or partial triumphs over the problem and instances of controlling the problem. Recruiting support or self-leagues. Narrative therapy tools. Deconstruction questions. To externalize a problem, what does depression whisper in your ear? Renaming questions. To support client efficacy, what would you call this problem of not paying attention to your wife? Perspective questions. To explore other people's views of the patient. Does everyone agree that you're not capable of managing your money, or does someone have a different idea? Opening space questions. To discover unique outcomes. Are there ever times when arguing doesn't control you? Narrative therapy tools continued. Hypothetical questions. Stimulate imagination to envision different outcomes. Suppose a miracle happened and depression was solved. How would your life be different? Preference questions. To make sure unique outcomes represent preferred experiences. Was that a positive or negative development? Story development questions. To develop new story from unique outcomes. How is this different from what you have done before? Narrative therapy for couples and families. Narrative therapy is for individuals, couples, or families. Effective with young women with eating disorders. Effective with men who are violent. Effective in reducing parent-child conflict. Effective with patients who are labeled as non-compliant, difficult, somatizing, self-defeating, depressed, or anxious. Narrative therapy tools. Meaning questions. To challenge negative images of self and emphasize positive beliefs. What does it say about you that you were able to do that? Relative influence questions. Explore how problem has disrupted the family. When depression gets the better of dad, how does that affect the family life? Bifurcation questions. Encourage client to align himself/herself against the problem. Is the event you're describing on the side of arguing or non-arguing? Narrative therapy tools continued. Questions to extend the story into future. To support changes and reinforce positive developments. What do you predict for the coming year? Stopper questions. Refocus client when he/she gets stuck in old story. Which story are you telling me now? Audience questions. Identify supportive witnesses to new story. Who in your life would be least surprised that you were able to make this change? Maintenance strategies. Finding witnesses and an audience for the new story. Using remembering conversations to enrich the presentation of the new story. Use reciprocal sharing or linking to others' lives by finding individuals who share same preferences, commitments, beliefs, or values of the new story. Maintenance strategies continued. Documentation of important achievements related to the new story through documents, certificates, notes, videotapes, and pictures. Writing of therapeutic letters to significant others, including the therapist. Integrate new rituals and celebrations into new story. Closing. One of the aspects associated with this work that is of central importance to us is the spirit of adventure. We aim to preserve this spirit and know that if we accomplish this, our work will continue to evolve in ways that are enriching to our lives and to the lives of those persons who seek our help.